My name's Dr. Adam and I'm a chiropractor. Now, the other day I was talking to a physio about posture and they were asking me, hey, I always hear chiropractors talk about posture all the time. And you guys talk about improving posture, neck posture, sitting posture, and I don't really understand why you think it's so important. So this is what I said to them. When we are looking at posture, when we're specifically looking at neck posture, we want to look at the curvature of the neck spine, okay, or the cervical spine. And the main reason for that is if your neck curve is 20 degrees or less, so that's basically when it's going forward, you're more likely to have neck symptoms in that area. Now, yes, we do see people come in who have a neck curvature of less than 20 degrees with no symptoms. But what we find is if they stay there long term, they're more likely to get symptoms in that neck area, whether it's localized neck pain up into the upper back and shoulders, or sometimes even headaches. Now, there's research that suggests if you get that neck curve to between 31 degrees and 40 degrees, you're less likely to have symptoms in those areas. So from a clinical point of view, when I'm talking to a physio or a GP, whilst we want the pain to reduce, we actually want to work to get that curve back to above 31 degrees, if not even further towards 40 degrees, because this is where they're going to be less likely to get those neck-associated symptoms. Other areas of posture that I talk to physios about is also the low back. So when we're looking at your low back, we're essentially looking at the lumbar lordosis, okay, and how that relates to the thoracic kyphosis. So when I was speaking to the physio, I was talking about this research paper, and it basically measures the curvature of the low back in relation to the curvature of the middle back. And what it shows us is if your increase or that lordosis is increased, often that same person will have an increase in their thoracic kyphosis, which can also lead to other symptoms in that area, also potentially lead to degeneration, which might cause further issues down the track. So remember, when we're dealing with posture and when we're speaking to people, we're not just saying it's because it looks good or anything like that. We're doing it based off research and we actually have clinical guidelines that we're trying to achieve.